Psychiatric Q&A. Part 2. 3.1. An 18-year-old woman is admitted to an inpatient mental health unit with the diagnosis of anorexia nervosa. A cognitive behavioral approach is used as part of her treatment plan. The nurse understands that the purpose of this approach is to a. Provide a supportive environment. b. Examine interpsychic conflicts and past issues. c. Emphasize social interaction with clients who withdraw. d. Help the client identify and examine dysfunctional thoughts and beliefs. The answer is D. Help the client identify and examine dysfunctional thoughts and beliefs. Cognitive behavioral therapy is used to help the client identify and examine dysfunctional thoughts and to identify and examine values and beliefs that maintain these thoughts. Options 1, 2, and 3 are incorrect. Test-taking strategy. Use the process of elimination and note the strategic words cognitive behavioral. Focusing on these words should direct you to option 4. If you are unfamiliar with this type of therapy and its purpose, review this content. 32. A nurse is preparing to care for a dying client, and several family members are at the client's bedside. Select the therapeutic techniques that the nurse will use when communicating with the family. Select all that apply. A. Discourage reminiscing. B. Make the decisions for the family. C. Encourage expression of feelings, concerns, and fears. D. Explain everything that is happening to all family members. E. Extend touch and hold the client's or family members' hand if appropriate. F. Be honest and truthful and let the client and family know that you will not abandon them. The answers are C. Encourage expression of feelings, concerns, and fears. E. Extend touch and hold the client's or family members' hand if appropriate. F. Be honest and truthful and let the client and family know that you will not abandon them. The nurse must determine whether there is a spokesperson for the family and how much the client and family want to know. The nurse needs to allow the family and client the opportunity for informed choices and assist with the decision-making process if asked. The nurse should encourage expression of feelings, concerns, and fears, as well as reminiscing. The nurse needs to be honest and truthful and let the client and family know that they will not be abandoned. Extend touch and hold the client's or family member's hand if appropriate. Test-taking strategy. Recalling therapeutic communication techniques and client and family rights will assist you in answering this question. Review these techniques in care of the dying client if you had difficulty with this question. 33. The depressed client verbalizes feelings of low self-esteem and self-worth typified by statements such as "I'm such a failure. I can't do anything right." The best nursing response would be to A. Tell the client that this is not true, that we all have a purpose in life. B. Identify recent behaviors or accomplishments that demonstrate the client's skills. C. Reassure the client that you know how the client is feeling and that things will get better. D. Remain with the client and sit in silence. This will encourage the client to verbalize feelings. The answer is B. Identify recent behaviors or accomplishments that demonstrate the client's skills. Feelings of low self-esteem and worthlessness are common symptoms of the depressed client. An effective plan of care to enhance the client's personal self-esteem is to provide experiences for the client that are challenging but that will not be met with failure. Reminders of the client's past accomplishments or personal successes are ways to interrupt the client's negative self-talk and distorted cognitive view of self. Silence may be interpreted as agreement. Options 1 and 3 give advice and devalue the client's feelings. Test-taking strategy. Use the process of elimination and therapeutic communication techniques. Focus on the client's diagnosis. You can eliminate options 1 and 3 easily. From the remaining options, focusing on the client's diagnosis will direct you to option 2. Review care of the client with depression if you had difficulty with this question. 34. A client is admitted to the hospital with a diagnosis of major depression, severe, single episode. The nurse assesses the client and identifies a nursing diagnosis of nutrition, less than body requirements, imbalanced related to poor nutritional intake. The appropriate nursing intervention related to this diagnosis is A. Weigh the client 3 times per week before breakfast. B. Explain to the client the importance of a good nutritional intake. C. Schedule brief nursing interactions with the client during several meals in which small portions are offered. D. Report the nutritional concern to the psychiatrist and obtain a nutritional consultation as soon as possible. The answer is C. Schedule brief nursing interactions with the client during several meals in which small portions are offered. Change in appetite is one of the major symptoms of depression. Other symptoms include a depressed mood, increased fatigue, feelings of worthlessness, diminished ability to think, or indecisiveness and psychomotor agitation or retardation. Option 2 is incorrect because the client is experiencing poor concentration. Thus, even if the client does understand the rationale, the client still may not be able to complete tasks. Weighing the client does not address how to increase nutritional intake. Reporting to the psychiatrist and the nutritionist is to some degree correct, but does not present a method to increase food intake. Test-taking strategy: use the process of elimination, focusing on the subject, poor nutritional status. Option 3 is the only option that addresses the imbalanced nutrition concretely and designs a method in which the client feasibly will increase the nutritional intake. Review care of the client with depression if you had difficulty with this. Question 35. The nurse is discharging a client with a history of command hallucinations to harm self or others. The nurse provides instructions to the client about interventions for hallucinations and anxiety and determines that the client understands the instructions if the client states, My medications won't make me anxious. B. I'll go to support group and talk so that I don't hurt anyone. C. I won't get anxious or hear things if I get enough sleep and eat well. D. I can call my therapist when I'm hallucinating so that I can talk about my feelings and plans and not hurt anyone. The answer is D. I can call my therapist when I'm hallucinating so that I can talk about my feelings and plans and not hurt anyone. The risk for impulsive and aggressive behavior may increase if a client is receiving command hallucinations to harm self or others. The nurse should ask the client whether he or she has intentions to hurt himself or herself or others. Talking about auditory hallucinations can interfere with subvocal muscular activity associated with a hallucination. Options 1, 2, and 3 will aid in wellness, but are not specific interventions for hallucinations, if they occur. Test-taking strategy: use the process of elimination. Options 1, 2, and 3 are interventions that a client can carry out to aid wellness. Option 4 is a specific agreement to seek help and evidence self-responsible commitment and control over one's own behavior. Review teaching points for a client with a history of hallucinations if you had difficulty with this question. 36. The nurse is performing an assessment on a client with dementia. Which data gathered during the assessment indicate a manifestation associated with dementia? A. Confabulation. B. Improvement in sleeping. C. Absence of sundown syndrome. D. Presence of personal hygienic care. The answer is A. Confabulation. The clinical picture of dementia varies from the development of mild cognitive defects to severe, life-threatening alterations in neurological functioning. For the client to use confabulation or the fabrication of events or experiences to fill in memory gaps is not unusual. Often, a lack of inhibitions on the part of the client may constitute the first indication of anything being wrong to the client's significant others. The client may undress in front of others or demonstrate slovenly table manners, but was formerly well-mannered. As the dementia progresses, the client will have episodes of wandering or sundowning. Test-taking strategy: use the process of elimination and focus on the client's diagnosis. Noting the subject, a manifestation, will direct you to option 1. If you had difficulty with this question, review the manifestations associated with dementia. 37. A client with a diagnosis of major depression, recurrent, with psychotic features, is admitted to the mental health unit. To create a safe environment for the client, the nurse most importantly devises a plan of care that deals specifically with the client's A. Self-care deficit. B. Imbalanced nutrition. C. Deficient knowledge. D. Disturbed thought processes. The answer is D. Disturbed thought processes. Major depression, recurrent, with psychotic features, alerts the nurse that in addition to the criteria that designates the diagnosis of major depression, one also must deal with the client's psychosis. Psychosis is defined as a state in which a person's mental capacity to recognize reality and to communicate and relate to others is impaired, thus interfering with the person's ability to deal with the demands of life. Disturbed thought processes generally indicate a state of increased anxiety in which hallucinations and delusions prevail. Although all the nursing diagnoses may be appropriate because the client is experiencing psychosis, option 4 is the correct option. Test-taking strategy: use the process of elimination. All the nursing diagnoses listed may be appropriate for a client diagnosed with major depression. The strategic words leading to the correct option are psychotic features, in which the client often suffers with disturbed thought processes, such as hallucinations and delusions. Review appropriate nursing diagnoses for major depression and psychotic features if you had difficulty with this question. 38. The nurse develops a nursing diagnosis of self-care deficit for an older client with dementia. Which of the following is an appropriate goal for this client? A. The client will function at the highest level of independence possible. B. The client will complete all activities of daily living independently within a 1-hour time frame. C. The client will be admitted to a long-term care facility to have activities of daily living needs met. D. The nursing staff will attend to all the client's activities of daily living needs during the hospital stay. The answer is A. The client will function at the highest level of independence possible. All clients, regardless of age, need to be encouraged to perform at the highest level of independence possible. Independence contributes to the client's sense of control and sense of well-being. Option 3 is incorrect, because what the self-care deficit entails is not known. To assume that the client requires long-term care based on so little information would be erroneous. Options 2 and 4 are close-ended statements. Test-taking strategy: use the process of elimination. Eliminate options 2 and 4 first because of the close-ended word all. From the remaining options, select option 1 because it is the umbrella option. Review care of the client with dementia if you had difficulty with this question. 39. The nurse is working with a client who has sought counseling after trying to rescue a neighbor involved in a house fire. In spite of the client's efforts, the neighbor died. Which action does the nurse engage in with the client during the working phase of the nurse-client relationship? A. Exploring the client's ability to function. B. Exploring the client's potential for self-harm. C. Inquiring about the client's perception or appraisal of the neighbor's death. D. Inquiring about and examining the client's feelings that may block adaptive coping. The answer is D. Inquiring about and examining the client's feelings that may block adaptive coping. The client must first deal with feelings and negative responses before the client can work through the meaning of the crisis. Option 4 pertains directly to the client's feelings. Options 1 and 2 do not directly address the client's feelings. Option 3 is more of an assessment question. Test-taking strategy: focus on the subject of the question, the working phase of the nurse-client relationship. Think about the interventions that occur in this phase. Using the process of elimination, focus on this subject and on the option that focuses on the feelings of the client. This will direct you to option 4. Review the phases of the nurse-client relationship if you had difficulty with this question. 40. A female client with anorexia nervosa is a member of a pre-discharge support group. The client verbalizes that she would like to buy some new clothes, but her finances are limited. Group members have brought some used clothes to the client to replace the client's old clothes. The client believes that the new clothes were much too tight and has reduced her calorie intake to 800 calories daily. The nurse analyzes this behavior as A. Normal behavior. B. Evidence of the client's disturbed body image. C. Regression as the client is moving toward the community. D. Indicative of the client's ambivalence about hospital discharge. The answer is B. Evidence of the client's disturbed body image. Disturbed body image is a concern with clients with anorexia nervosa. Although the client may struggle with ambivalence and show regressed behavior, the client's coping pattern relates to the basic issue of disturbed body image. The nurse should address this need in the support group. Test-taking strategy. Use the process of elimination, focusing on the information provided in the question, which is related directly to an altered body image. This should direct you to the correct option. Review the needs of the client with anorexia nervosa if you had difficulty with this question. 41. During the termination phase of the nurse-client relationship, the clinic nurse observes that the client has made several sarcastic remarks and has an angry effect. The most appropriate interpretation of the behavior is that the client A. Needs to be admitted to the hospital. B. Needs to be referred to the psychiatrist as soon as possible. C. Requires further treatment and is not ready to be discharged. D. Is displaying typical behaviors that can occur during termination. The answer is D. Is displaying typical behaviors that can occur during termination. In the termination phase of a relationship, it is normal for a client to demonstrate a number of regressive behaviors that can be disturbing to the nurse. Typical behaviors include return of symptoms, anger, withdrawal, and minimizing the relationship. The anger that the client is experiencing is a normal behavior during the termination phase and does not necessarily indicate the need for hospitalization or treatment. Test-taking strategy. Note the strategic words termination phase. This alone may assist in directing you to option 4. Additionally, note that options 1, 2, and 3 are comparable. These options address the need for further supervised treatment. If you are unfamiliar with the client behaviors associated with the termination phase, review this content. 42. A client who is delusional says to the nurse, "The federal guards were sent to kill me." The nurse's best response is A. I don't believe this is true. B. The guards are not out to kill you. C. What makes you think the guards were sent to hurt you? D. I don't know anything about the guards. Do you feel afraid that people are trying to hurt you? The answer is D. I don't know anything about the guards. Do you feel afraid that people are trying to hurt you? For the nurse to empathize with the client's experience is most therapeutic. Disagreeing with delusions may make the client more defensive, and the client may cling to the delusions even more. Encouraging discussion regarding the delusion is inappropriate. Test-taking strategy. Use therapeutic communication techniques. Eliminate options 1 and 2 because they are comparative or alike and are statements that disagree with the client. Option 3 encourages discussion regarding the delusion. Review communication techniques with the client experiencing delusions if you had difficulty with this question. 43. A client who has just been sexually assaulted is quiet and calm. The nurse analyzes this behavior as indicating which defense mechanism? A. Denial. B. Projection. C. Rationalization. D. Intellectualization. The answer is A. Denial. Denial is refusal to admit to a painful reality and may be a response by a victim of sexual abuse. Projection is transferring one's internal feelings, thoughts, and unacceptable ideas and traits to someone else. Rationalization is justifying the unacceptable attributes about oneself. Intellectualization is the excessive use of abstract thinking or generalizations to decrease painful thinking. Test-taking strategy. Use the process of elimination and note the strategic words calm and quiet. These behaviors indicate denial in a sexually abused victim. If you had difficulty with this question, review content related to the sexually abused victim and defense. Mechanisms. 44. A client with a diagnosis of major depression who has attempted suicide says to the nurse, "I should have died. I've always been a failure. Nothing ever goes right for me." The therapeutic response to the client is A. I don't see you as a failure. B. You have everything to live for. C. Feeling like this is all part of being ill. D. You've been feeling like a failure for a while? The answer is D. You've been feeling like a failure for a while? Responding to the feelings expressed by a client is an effective therapeutic communication technique. The correct option is an example of the use of restating. Options 1, 2, and 3 block communication because they minimize the client's experience and do not facilitate exploration of the client's expressed feelings. Test-taking strategy. Use the process of elimination and therapeutic communication techniques to direct you to the option that directly addresses the client's feelings and concerns. Also, option 4 is the only option stated in the form of a question and is open-ended, thus, it will encourage the verbalization of feelings. Review therapeutic communication techniques if you had difficulty with this. Question. 45. The community health nurse visits a client at home. The client states, "I haven't slept at all the last couple of nights." Which response by the nurse illustrates a therapeutic communication technique for this client? A. Go on. B. Sleeping. C. You're having difficulty sleeping. D. Sometimes, I have trouble sleeping too. The answer is C. You're having difficulty sleeping? Option 3 uses the therapeutic communication technique of restatement. Although restatement is a technique that has a prompting component to it, it repeats the client's major theme, which assists the nurse to obtain a more specific perception of the problem from the client. Options 1, 2, and 4 are not therapeutic responses. Test-taking strategy. Use the process of elimination. Option 1 is a general lead and allows the client to direct the discussion. Option 2 uses reflection, which simply repeats the client's last words to prompt further discussion. Option 4 focuses on the nurse's problem. Option 3 will provide the perception of the problem from the client's perspective. Review therapeutic communication techniques if you had difficulty with this question. 46. When planning the discharge of a client with chronic anxiety, the nurse directs the goals at promoting a safe environment at home. The appropriate maintenance goal should focus on which of the following? A. Ignoring feelings of anxiety. B. Identifying anxiety-producing situations. C. Continued contact with a crisis counselor. D. Eliminating all anxiety from daily situations. The answer is B. Identifying anxiety-producing situations. Recognizing situations that produce anxiety allows the client to prepare to cope with anxiety or avoid a specific stimulus. Counselors will not be available for all anxiety-producing situations, and this option does not encourage the development of internal strengths. Ignoring feelings will not resolve anxiety. Elimination of all anxiety from life is impossible. Test-taking strategy. Use the process of elimination. Eliminate option 4 first, because of the word all. Eliminate option 1 next, because feelings should not be ignored. From the remaining options, select option 2 because this option is more client-centered and helps prepare the client to deal with anxiety should it occur. Review home care planning for the client with chronic anxiety if you had difficulty with this question. 47. All treatment team members are seen as equally important in helping clients meet their treatment goals. This type of therapy approach is A. Milieu therapy. B. Interpersonal therapy. C. Behavior modification. D. Rational emotive therapy. The answer is A. Milieu therapy. All treatment team members are viewed as significant and valuable to the client's successful treatment outcomes in milieu therapy. Behavior modification is based on rewards and punishment. Rational emotive therapy deals with the correction of distorted thinking. Interpersonal therapy, on the other hand, is based on a one-to-one or group therapy approach in which the therapist-client relationship is often used as a way for the client to examine other relationships in his or her life. Test-taking strategy: focus on the subject. Note the relationship between the words helping clients to meet their treatment goals and option 1. Review the types of therapy noted in the options if you had difficulty with this question. 48. A home health nurse is talking to the spouse of a client taking an antidepressant. The spouse says, "Now that my husband is responding to the antidepressant, the suicidal risk is over and you can stop making these home visits." After analyzing this statement, which of the following is the appropriate nursing response? A. I need to continue with my visits. Your comment reflects a lack of knowledge that this disease runs in families. B. I agree with you. Clients who want to kill themselves are only suicidal for a limited time. No one can feel self-destructive forever. C. I agree with you. The suicidal threats were really attention-seeking. Continuing to visit would reinforce your husband's use of manipulation. D. I need to continue with my visits. Most suicides occur within 3 months after improvement begins because the client now has the energy to carry out the suicidal intentions. The answer is D. I need to continue with my visits. Most suicides occur within 3 months after improvement begins because the client now has the energy to carry out the suicidal intentions. Most suicides occur within 3 months after the beginning of the improvement, when the client has the energy to carry out the suicidal intentions. Options 1, 2, and 3 are incorrect because they fail to address safety and involve giving false information. Test-taking strategy: use the process of elimination and knowledge regarding the facts about suicide to answer the question. Recalling that a critical time for a suicidal client is when the client has energy will direct you to option 4. Review the concepts related to suicide and therapeutic communication techniques if you had difficulty with this question. 49. The supervisor reprimands the nurse in charge of the nursing unit because the charge nurse has not adhered to the unit budget. Later that afternoon, the charge nurse accuses the nursing staff of wasting supplies. This behavior is an example of A. Denial, B. Repression, C. Suppression, D. Displacement. The answer is D. Displacement. Ego defense mechanisms are operations outside of a person's awareness that the ego calls into play to protect against anxiety. Displacement is the discharging of pent-up feelings on persons less threatening than those who initially aroused the emotion. Denial is the blocking out of painful or anxiety-inducing events or feelings. Repression is unconsciously keeping unacceptable feelings out of awareness. Suppression is consciously keeping unacceptable feelings and thoughts out of awareness. Test-taking strategy: use the process of elimination. Read the behavior identified in the question to assist you in determining the type of ego defense mechanism or behavior used. Remember that displacement is the discharging of pent-up feelings on persons less threatening than those who initially aroused the emotion. If you had difficulty with this question, review defense mechanisms. 50. The manic client announces to everyone in the day room that a stripper is coming to perform this evening. When the nurse firmly states that this will not happen, the manic client becomes verbally abusive and threatens physical violence to the nurse. Based on the analysis of this situation, the nurse determines that the appropriate action would be to A. Orient the client to time, person, and place. B. Tell the client that the behavior is not appropriate. C. Escort the manic client to her room, with assistance. D. Tell the client that smoking privileges are revoked for 24 hours. The answer is C. Escort the manic client to her room, with assistance. The client is at risk for injury to self and others and therefore should be escorted out of the day room. Antipsychotic medications are useful to manage the manic client. Hyperactive and agitated behavior usually responds to haloperidol, Haldol. Option may fourth increase the agitation that already exists in this client. Orientation will not halt the behavior. Telling the client that the behavior is not appropriate already has been attempted by the nurse. Test-taking strategy: use the process of elimination and Maslow's hierarchy of needs theory to answer the question. Look for the option that promotes safety of the client, other clients, and staff. If you had difficulty with this question, review the appropriate interventions when dealing with a manic client. 51. The nurse is caring for a client with anorexia nervosa. The nurse is monitoring the behavior of the client and understands that the client with anorexia nervosa manages anxiety by a. Engaging in immoral acts. B. Always reinforcing self-approval. C. Observing rigid rules and regulations. D. Having the need always to make the right decision. The answer is C. Observing rigid rules and regulations. Clients with anorexia nervosa have the desire to please others. Their need to be correct or perfect interferes with rational decision-making processes. These clients are moralistic. Rules and rituals help the clients manage their anxiety. Test-taking strategy: use the process of elimination and focus on the subject, managing anxiety. Eliminate options 2 and 4 because of the close-ended word always. Option 1 is not characteristic of the client with anorexia. Review the characteristics associated with this disorder if you had difficulty with this question. 52. Select the appropriate interventions for caring for the client in alcohol withdrawal. Select all that apply. A. Monitor vital signs. B. Maintain an NPO status. C. Provide a safe environment. D. Address hallucinations therapeutically. E. Provide stimulation in the environment. F. Provide reality orientation as appropriate. The answers are A. Monitor vital signs. C. Provide a safe environment. D. Address hallucinations therapeutically. F. Provide reality orientation as appropriate. The stages of group development include the initial stage, the working stage, and the termination stage. During the initial stage, the group members become acquainted with each other and some structuring of group norms, roles, and responsibilities take place. During the initial stage, group interaction involves superficial conversation. During the working stage, the real work of the group is accomplished. During the termination stage, the group evaluates the experience and explores members' feelings about the group and the impending separation. Test-taking strategy: focus on the subject, the termination stage. Reading each item presented and recalling the stages of group development will assist in answering this question. Review these stages if you had difficulty with this question. 53. Select the characteristics of the termination stage of group development. Select all that apply. A. The group evaluates the experience. B. The real work of the group is accomplished. C. Group interaction involves superficial conversation. D. Group members become acquainted with each other. E. Some structuring of group norms, roles, and responsibilities take place. F. The group explores members' feelings about the group and the impending separation. The answers are A. The group evaluates the experience. F. The group explores members' feelings about the group and the impending separation. The stages of group development include the initial stage, the working stage, and the termination stage. During the initial stage, the group members become acquainted with each other and some structuring of group norms, roles, and responsibilities take place. During the initial stage, group interaction involves superficial conversation. During the working stage, the real work of the group is accomplished. During the termination stage, The group evaluates the experience and explores members' feelings about the group and the impending separation. Test-taking strategy, focus on the subject, the termination stage. Reading each item presented and recalling the stages of group development will assist in answering this question. Review these stages if you had difficulty with this question. 54. The nurse is caring for a client who is scheduled for electroconvulsive therapy. The nurse notes that an informed consent has not been obtained for the procedure. On review of the record, the nurse notes that the admission was an involuntary hospitalization. Based on this information, the nurse determines A. That the physician will provide the informed consent. B. That an informed consent does not need to be obtained. C. That an informed consent should be obtained from the family. D. That an informed consent needs to be obtained from the client. The answer is D. That an informed consent needs to be obtained from the client. Clients who are admitted involuntarily do not lose their right to informed consent. Clients must be considered legally competent until they have been declared incompetent through a legal proceeding. The informed consent needs to be obtained from the client. Test-taking strategy, knowledge regarding the hospital admission processes and clients' rights is necessary to answer this question. If you had difficulty with this question, focus on the subject of client rights to direct you to option 4. Review client rights if you had difficulty with this question. 55. The nurse employed in a mental health unit is assigned to care for a client admitted to the unit 2 days ago. On review of the client's record, the nurse notes that the admission was a voluntary admission. Based on this type of admission, the nurse anticipates which of the following? A. The client will resist treatment measures. B. The client will be angry and will refuse care. C. The client's family will resist treatment measures. D. The client will participate in the planning of the care and treatment plan. The answer is D. The client will participate in the planning of the care and treatment plan. Generally, the client seeks voluntary admission. A voluntary admission permits a client to make a written application for admission. If the client seeks voluntary admission, the most likely expectation is that the client will participate in the treatment program. Options 1, 2, and 3 are not characteristics of this type of admission. Test-taking strategy, use the process of admission. Note the strategic words voluntary admission. This should direct you to option 4. Additionally, note that options 1, 2, and 3 are comparative or alike. Review the various types of hospital admission processes if you had difficulty with this question. 56. A client with major depression is considering cognitive therapy. The client asks the nurse, "How does this treatment work?" The nurse responds and tells the client that this type of treatment will help you relax and develop new coping skills. B. This type of treatment helps you confront your fears by gradually exposing you to them. C. This type of treatment helps you examine how your past life has contributed to your problems. D. This type of treatment helps you examine how your thoughts and feelings contribute to your difficulties. The answer is D. This type of treatment helps you examine how your thoughts and feelings contribute to your difficulties. Cognitive therapy frequently is used for clients with depression. This type of therapy is based on exploring the client's subjective experience. Cognitive therapy includes examining the client's thoughts and feelings about situations and how these thoughts and feelings contribute to and perpetuate the client's difficulties and mood. Test-taking strategy, focusing on the word cognitive, will assist you in selecting the correct option. Look for a similar word used in the question and repeated in one of the options. Note the relationship of the word cognitive in the question and thoughts in option 4. Review this form of therapy if you had difficulty with this question. 57. The client is unwilling to go out of the house for fear of doing something crazy in public. Because of this fear, the client remains homebound, except when accompanied outside by the spouse. Based on this data, the nurse determines that the client is experiencing A. Agoraphobia, B. Social phobia, C. Claustrophobia, D. Hypochondriasis. The answer is A. Agoraphobia. Agoraphobia is a fear of open spaces and a fear of being trapped in a situation from which there may not be an escape. Agoraphobia includes the possibility of experiencing a sense of helplessness or embarrassment if an attack occurs. Avoidance of such situations usually results in reduction of social and professional interactions. Social phobia focuses more on specific situations, such as the fear of speaking, performing, or eating in public. Claustrophobia is a fear of closed places. Clients with hypochondriacal symptoms focus their anxiety on physical complaints and are preoccupied with their health. Test-taking strategy: use the process of elimination. Focusing on the strategic words "remains homebound" will direct you to option 1. If you had difficulty with this question, review phobia types and associated client behaviors. 58. The nurse is providing care to a client admitted to the hospital with a diagnosis of acute anxiety disorder. While conversing with the client says to the nurse, "I have a secret that I want to tell you. You won't tell anyone about it, will you?" The appropriate nursing response is which of the following? A. No, I won't tell anyone. B. I cannot promise to keep a secret. C. If you tell me the secret, I will tell it to your doctor. D. If you tell me the secret, I will need to document it in your record. The answer is B. I cannot promise to keep a secret. The nurse should never promise to keep a secret. Secrets are appropriate in a social relationship, but not in a therapeutic one. The nurse needs to be honest with the client and tell the client that a promise cannot be made to keep the secret. Options 1, 3, and 4 are inappropriate responses. Test-taking strategy: use the process of elimination. Option 1 can be eliminated easily because it is inappropriate. Options 3 and 4 are not only inappropriate but are also somewhat threatening and may even block further communication. Review therapeutic communication techniques and the nurse-client relationship if you had difficulty with this question. 59. A nurse is conducting a group therapy session. During the session, a client with mania consistently talks and dominates the group session, and her behavior is disrupting group interactions. The nurse would initially A. Ask the client to leave the group session. B. Ask another nurse to escort the client out of the group session. C. Tell the client that she will not be able to attend any future group sessions. D. Tell the client that she needs to allow other clients in the group time to talk. The answer is D. Tell the client that she needs to allow other clients in the group time to talk. Manic clients may be talkative and can dominate group meetings or therapy sessions by their excessive talking. If this occurs, the nurse initially would set limits on the client's behavior. Initially, asking the client to leave the session or asking another person to escort the client out of the session is inappropriate. This may agitate the client and further escalate the client's behavior. Option 2 is also an inappropriate initial action because it violates the client's right to receive treatment and is a threatening action. Test-taking strategy: use the process of elimination and note the strategic word initially. Eliminate options 1 and 2 first because they are comparative or alike. Next, eliminate option 3 because it violates the client's right to receive treatment and is a threatening action. Remember that setting firm limits with the client initially is best. Review. Care of a client with mania if you had difficulty with this question. 60. The nurse observes that a client is pacing, agitated, and presenting aggressive gestures. The client's speech pattern is rapid, and affect is belligerent. Based on these observations, the nurse's immediate priority of care is to A. Provide safety for the client and other clients on the unit. B. Provide the clients on the unit with a sense of comfort and safety. C. Assist the staff in caring for the client in a controlled environment. D. Offer the client a less stimulated area to calm down and gain control. The answer is A. Provide safety for the client and other clients on the unit. Safety of the client and other clients is the priority. Option 1 is the only option that addresses the client and other clients' safety needs. Option 2 addresses other clients' needs. Option 3 is not client-centered. Option 4 addresses the client's needs. Test-taking strategy. Note the strategic words immediate priority and use Maslow's hierarchy of needs theory to prioritize. Note the words agitated, aggressive, and belligerent. Safety is the strategic subject. Option 1 is the umbrella option and addresses the safety of all. Review nursing interventions to provide safety to clients if you had difficulty with this question.